My name is Peter Jones with Microsoft Canada. I'm the industry lead for healthcare. There's a growing challenge in the healthcare system today to effectively reach a targeted population to provide proper screening, diagnosis, and treatment for chronic conditions. With me today is Elizabeth Lounsbury from Knowledgetech. Welcome and thank you for joining us today.
Thank you.
In your words, can you tell us a little bit more about patient outreach?
Sure. I think that patient outreach is basically any proactive effort that's happening by a healthcare organization to educate the population on health and wellness issues.
Can you share with us some examples?
Certainly. So around cancer screening programs, we often see outreach efforts for recruitment and recall to get people into cancer screening programs. On disease prevention, we saw a really great example of this recently with the H1N1 outbreak. We had the whole vaccine, everyone getting vaccinated, and then we had a massive outreach program to educate the public on basically personal and workplace hygiene. You saw those hand sanitizers coming out everywhere. That's a great example of a patient outreach campaign in the works. And some other examples that we see often are disease management, around clinical trials, drug monitoring, patient education, and support programs.
Oh, wonderful. What are the challenges in developing a patient outreach program?
Well, there's a number of challenges. I think one of the primary issues is that we're seeing a lot of people today who no longer have a primary health care provider. And traditionally, a lot of the messaging that we received on preventative care came from our primary health care providers. So without that link, we're missing that message. So we're really looking for a solution to that problem with a patient outreach program. Outreach programs are also seeing a lot of challenges around handling the vast amounts of data that they get from many different sources, both from various clinical information systems, ministries of health, various sources that they have to basically pull this data together and figure out who in that is their target population. And I think another key issue is around highly fragmented IT departments at a lot of the primary care levels. And so what that results in is it makes it very difficult to uniquely identify a client. So who is it that you're reaching out to?
Okay. Can you tell us more a little bit how you solved this problem?
Yes, so we developed a solution with BC Cancer to help them and support their full life cycle throughout their outreach program. And the patient outreach solution basically helps on 4 different areas. First is recruiting people into the outreach program. So that's figuring out who your target population is and reaching out to them and getting them involved, sending them out the letters and getting their involvement. The second is managing their experience once they've accepted the letter and they're in the program, and managing all of the interactions that they have with the agency. As well, we want to make sure that we're able to report on the progress of that recruitment effort and taking a look at some of the key performance indicators around the program, see how well the program is doing. And then, of course, retaining those people once they're in the program.
Can you share with us some of the impact that you've seen?
Yes, so we've seen some really great impacts from the solution that we developed. So we see recruitment times being cut from several months down to several days to prepare for a single campaign. Recall can be fully automated, so that's the retention of people in the program. And I think the bottom line here is really with the solution, it enables a greater capacity to reach a defined population. Because of that, we can get some higher rates in the screening programs and ultimately increase our program effectiveness.
So there's actually a lot of concerns on privacy and patient data. Can you tell us a little bit how you address this challenge?
Yes, so privacy is certainly very important. One of the first things that we did was we completed a privacy impact assessment to ensure that we were meeting all of the legislative requirements. And then we also wanted to make sure that we were ensuring privacy of client data within the solution itself. And we did that by selectively screening all the relevant data from our client registry and using only that information that's required to maintain the outreach program, and anything else that isn't required we don't touch.
So if someone is considering implementing an outreach program like this, what things do they need to consider?
I think one of the primary things that they need to consider is taking a step back and looking at what their requirements are. Take a look at your existing processes and where your pain points are, and make sure that you have a good understanding of what it is you're trying to change and what you want your new solution to address. Once you get to the point of selecting a tool, I know many organizations often face a build versus buy decision. And I think what I would really recommend there is just make sure that you have a platform that's going to be flexible enough to grow as your programs change and evolve. And for BC Cancer, this was a high priority for them, and that's a good reason why they chose Dynamic CRM, good part of the reason. So I would really just recommend making sure that your platform is going to support you as your programs change.
Okay, good. Thank you. So it's great to understand how patient outreach programs can have a dramatic impact on managing chronic conditions. I'd like to thank you for your time today in sharing your expertise with us. So thank you.
Thank you.